Health. Once again, back here at home filming this one. Today's class, I'm going to give you a fair bit of information. There's no task required within that information, just some note taking. And I'm going through 4 new pieces of information, and all of them are different indicators of health status. And remember that when we talk about health status, we're talking about either an individual or a population. And that population can be a small population of like people or a population of an entire country. So last week, 5 dimensions of health, good to categorize somebody's overall health and well-being. And then this week, we're looking at all those measurement status factors for when you are categorizing somebody's health and how you can look at some data and look at trends and look at numbers and actually equate that into good health or poor health. So I want to very quickly just show you obviously where today's work is, and then just give you a very, very quick recap and rundown for anyone who might have missed something, forgot something, or has just been taking the notes without actually taking it in. So for the first couple of minutes, just listen, and then I'll tell you when it's time to start adding to your notes. Don't forget to continually update your glossary. That glossary, for those of you who continue in VCE Health Year 11 and 12, if you keep these glossaries, they are going to be super helpful when it comes time for studying for SACs in Year 12. If you've just got those key important words in front of you, it's really going to help you earn marks on a SAC in Year 12. So let's just go with where we're at right now. Obviously, today's lesson plan is here. There is a website link, and you'll be using that for your last activity for the day. And under learning tasks, we're still uploading into Term 3, Week 2. And the resources that we're using is in Term 3, Week 2, and today we'll be using all 3 of these documents. I've made some changes to the PowerPoint, which I plan on updating for those of you who want to download the new version, but what you see in my YouTube is the most updated version. You will need the Venn diagram. That is the task that you are uploading today into Term 3, Week 2, and you'll continue on with your glossary here. So just a reminder that glossary, we're going through a few things today. You should have been able to fill in health indicators, health status. Incidence will come up today. Life expectancy we've done. Morbidity will come up today. Prevalence will come today. And years of life lost will come today. So there'll only be 1 or 2 of these that are left. You should nearly be finished your glossary today. Let's just have a very, very quick flip through. First thing we did was look at the definition of health status. The next thing we did was talk that we want to be able to measure the status of health within individuals and populations. And then we said we want to plot somebody's health status upon a continuum. Somebody is not just healthy or unhealthy. They fit somewhere along this continuum, and we completed an activity around that. Then we said, okay, there's a whole bunch of different things that we can use to indicate somebody's health status and whether they would be high on that continuum or low on that continuum. And you guys did a little bit of a self-assessment on your own status of health at this current point. During the lesson yesterday, I went through life expectancy for you in the video. And I didn't have any emails asking questions, and I've looked at those people who did submit their work, and it's really good so far that people are taking good notes. I'm even seeing some people change the wording of this into words that they would use. So that's a really good sign that people are understanding this. But once again, if you're unsure of any of the content that I'm going through, please request a private Zoom, request a group Zoom, or just simply ask me via email and I will get back to you. So we looked at some stats, and then we also looked at mortality. And this was probably the first thing here that was maybe a brand new word or unknown. I mean, we might have heard mortal before, but to hear mortality and get a definition of it might have been the first thing that's come up that is brand new to some people. And it was talking about the rate of death and presenting it per a standard number of people in a 12-month period. One of the other things that you saw here, and I mentioned it but skipped over it, was years of life lost. We'll talk about that today to give you an understanding of what that exactly means. We went through some numbers, and then you went on to some websites to find some answers out. Finally, we talked about trends, and once again, I was pretty confident that at Year 10 level, after the number of mathematics lessons you've had so far through primary and secondary, you should know what a trend is. But trends are oh so critical in health, and so we had to discuss them. We had to bring them to the forefront of your mind, and I asked you to have a look at some trends and write about them. So here's where we currently sit, and obviously this pencil needs, you're going to need to take some notes now, either by hand and then keeping that photo record for me, or by typing it into your Word document. So one of the other things that we can look at for a country or a population in terms of their health status overall is looking at the number of years of life lost. Now, this is life that's lost due to premature death. So remember that we spoke about a life expectancy, and at a certain age, an individual has a life expectancy of, it might be 83 years old. Now, in this example here, if a young girl was to pass away at the age of 14 due to a car accident, that's not something that we expect. It's a very sad situation. And what's actually happened here is that that young girl at the age of 14 is expected to live to 84 years old. She's actually lost 70 years of what was expected of her life. Now, most of the time it's injuries and illnesses that have taken away the life prematurely, but years of life loss can also be an indicator that a country is starting to trend downwards in terms of their health status overall. So it's important to look at when people die, what are the number of people that are dying younger than expected, and actually equate that to a number that says what is the number of years of life lost. So you can see here some different causes of death, and this is broken into categories of males, females, and different age categories of youth, 10 to 14, 15 to 19 again. And we're actually looking at the size of the overall graph if you want to look at all males and all females from 10 to 19 years old. And what we see is that the major cause of death that is costing years of life lost overall is road traffic incidents. So you can see why when you turn your television on, when you're driving down the freeway, there's advertisements about buckling up and driving safely and don't drink and drive, and there's booze buses out there and there's speed cameras out there. This is the country trying to help keep people alive because the statistics are telling us that we need to pour money into safer roads, safer drivers, and people making smarter decisions because it is costing us, especially this category here, males 15 to 19 years old. Look at the size of the amount of years of life lost, people dying prematurely before their life expectancy because of road traffic incidents. So I ask you, if you look at these, are you seeing advertisements on TV? Are you seeing things on the side of the road? Are you hearing numbers to call, etc., for some of these major causes of death in youth and the cost of years of life lost? Now, the next thing I want you to take some notes on is the morbidity. So this is not mortality, it's different. This is morbidity. In terms of morbidity, we're talking about people who have ill health. And we're talking about the rate in which people have ill health in their life. So we refer to ill health as disease, injury, or disability. Not all of these will actually end in death. People can have a broken arm or a broken leg as an injury, but that's not a fatal condition. So it's important to look deep about this because it's the ill health of individuals when we talk about morbidity. So it can be small injuries that are documented as well. So what we want to do, my apologies for flipping through that page. What we want to do here is we want to look at the two different ways to look at it. We can actually just look at the number of people who do report a condition, which would take into consideration all those small conditions as well, and also the years lost due to disability. So similar to years of life lost, but this is years lost due to disability. So that disability, that disease, that injury that has caused maybe a premature death, that is a number that I think is more important when looking at the overall health status. But if we are finding that there's a lot of people getting a broken arm, broken leg, etc., because this morbidity rate is high, well, we need to look at what's the risk-taking behaviour. What are the safety mechanisms we can put in place to help people from stop those broken bones, etc. When we do look at morbidity, there's two things that come into play: incidence and prevalence. And I think it's critical that we talk about those today before moving on. So, incidence. This is the number of new cases of a condition in usually 12 months. Now, we like to represent this per 1,000 people, not the 10,000 or 100,000s that you've been seeing the other day in other categories. This is per 1,000 people. And it's also good in telling us what conditions are increasing and what conditions are decreasing, and whether our medical advice is working well or not, and what we need to maybe start putting some research money into. So let's just take one example on this next page to show you what incidence really means and how it can be calculated. Don't forget to take notes about what incidence is. So the incidence rate for asthma was 6.8, and that's for every 1,000 males in the 10 to 14 category. So that means that 1,000 males that are in that age category for that year, 6.8 of them were being diagnosed with asthma. So if there were 2,000 males, then it would be close to 13 individuals. So the way that we actually calculate it is that we need to know how many males or females, whichever category you're looking at, are actually in existence in that country in that year for that age category. So in 2017, there was about 756,500 males in that age category, and we know what the incidence rate was. So to calculate the total number of cases, what we like to do, and it's quite a strange calculation until you get to the end, is that we take the rate, our 6.8, and because that's per 1,000, we actually go 6.8 divided by 1,000. Now, if you look at the answer to that in your calculator, it'll be a very small number, 0.0 something something something, because that's what's telling us what the chance of one individual in that age category being diagnosed with asthma at that time. But we know there's not one individual, there's 756,500. So if we take that number times by 756,500, it will tell us exactly how many males, 10 to 14 in 2017, were diagnosed with asthma. So we can take just that number and take it all around the world, depending on what their number is. It's comparable. There might be 756,500 males in this category in 2017 in Australia, but there might be 925,000 in America. And so the actual number doesn't equate until we bring it down to this incidence per 1,000. The other thing that we mentioned on that morbidity page was prevalence. So incidence was the total number of new cases diagnosed, and prevalence is the total number of cases at a given time. So it's usually across the 12 months, and it is per 1,000 people, so it's comparable. And this includes the current cases that carried over from 2016, and those people are still within that age category, and also the new incidence cases need to be added together. So here's an example of some calculations here. In 2017, there was 715,500 females in the 10 to 14 category, and we know that in total there were 77,277 that suffered from asthma. So we know how many females there were, and we know how many, these are new and old cases, that suffered from asthma in that age category. Because we want this answer to be per 1,000 people, so it's comparable to the incidence, we're going to take the total number and divide by 1,000 people, and we get given this midway point number, which again doesn't really make sense yet. And then what we do is we multiply that, we take that number of actual cases and we divide it by the number per 1,000, and we end up finding out the exact number of cases per 1,000 at the end of that year. So if we were to go back and look at the incidence at that 10 to 15 category, 10 to 14, my apologies, for females, we would see that the number was around about 8, and yet there's 108 cases. That means we actually can work out as well roughly how many cases were carried over from the previous year by a simple subtraction. I'm going to leave it here. We will go through years of life lost due to disability next week and finish off these slides at that point. So don't forget to go back through your glossaries. What I would like to draw your attention to now, after you've taken these notes, and if you've got any questions, ask me, is this website here, which is the World Health Organization. Now, the website that you went to yesterday was Australian Health Statistics. This is the World Health Statistics. And the website link that I've given you takes you to adolescent health, which is roughly the age category here, 10 to 19, that we've been talking about this semester and in all of our notes and so far on our PowerPoint. I'd like to draw your attention over here to this right-hand side where it says data. And if you open this data up, you can have a look at some different countries' profiles. That's where I think should be your starting point for today, but feel free to look further. When you go into the country profile, you can pick whichever country you want. It's going to take a little while to load up, I apologize. There's a fair bit of data and information in this website. Very exciting YouTube that you're watching when you're watching just a page load. Might just open up the Venn diagram while we wait here and come back to this. The task that you're going to be having to complete is a Venn diagram. And in this Venn diagram, and hopefully you know how to use a Venn diagram. Now I can see that website's loaded. I'll go back to it in a moment. What I need you to do is take one of the two major circles, and that is going to be the circle that represents youth in Australia. And the other circle is going to be youth in other countries. So it's not just one other country. When I flip back to the website, you're going to notice one country, but I'm going to get you to look at a few of them. And in order to get a really good view of what's going on, I would suggest that you look at a few countries that you believe would have quite a healthy group in that youth population. And I want you to look at a few countries that you think would have an unhealthy youth in their population. And what I would like you to do is anywhere in this part of the circle, you will fill in all the factors that are just relevant for youth in Australia, whether they're positive or negative. And all over here is going to be the factors that are just prevalent and occurring in the youth in other countries, but we don't see within Australia. And then in this middle category here, you're going to be filling in some factors that you're noticing and some data and some trends about what's happening with youth in Australia and the rest of the world. It's quite a difficult task because going through this diagram here is very, very challenging to know, what do I look at? We're in the Afghanistan country at the moment, and we're looking at number of population, adolescent population. Because a lot of these trends are per 1,000 or per 100,000, we don't need to know that there's 9.8 million adolescents, so we can skip through that. Now, life expectancy, that's interesting. You might want to jot that down on a piece of paper and then go and look at America and then go and look at England and then go and look at Australia and see, are these numbers the same or different? Because that might give you something to talk about in your Venn diagram. You might look at employment and have a look at this number. You might also look over here at the percentage of people who are smoking cigarettes, the percentage of people who are insufficiently physically active or are drinking alcohol. I think there's some really interesting pieces of information here. The number of adolescents aged 10 to 19 living with HIV or AIDS. Have a look at those numbers for other countries. So simply click on the drop-down box over here, load up another country, and you can actually load up more than one country at one time and see the differences between those two countries and it will give you a really good indication as to where Australia sits compared to others. Once you've finished today's notes on those 4 new things, once you've finished morbidity, years of life lost, incidence, and prevalence, you have notes for each of the 4 and you're feeling comfortable and confident about those 4 topics. Move on to the Venn diagram activity. Once you've completed your Venn diagram activity through research on the World Health Organization website, I want you to upload the Venn diagram task for today. Don't forget to continually update your glossary. I am available if you need me, if you want to ask anything, you don't understand the calculations, you don't understand what something means, just ask. We can set up a Zoom, I can answer you via email. I need you to have an understanding of this. We have an outcome task next week. That outcome task is a research-based task that goes across Wednesday and Thursday's lessons, where you are going to use your knowledge of the 5 dimensions of health and the measurement of health status that we've gone through today, yesterday, and Monday, and we are going to finish off on Monday of next week. And you're going to hand to me at the end of Thursday your research task, which uses your knowledge and skills of what I've taught you and your abilities to research countries and populations and data. If you don't know, it's going to be hard for me to answer it at the time if I'm getting bombarded, so start asking questions now. Go back through that PowerPoint. Is there anything up until that slide number 24 that we've been through so far that you don't understand? And simply ask me. I'll see you soon.